I will call the regular session of the Blackhawk County Board of Supervisors meeting to order. Mr. Jamison, roll call vote, please.
Leyland?
Here.
Little?
Here.
Schwartz?
Here.
White?
Here.
Trelka?
Here. Please join me for a moment of silence to reflect on our action. Please join me for the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'll entertain a motion to receive the agenda as proposed or amended.
Second.
It's been moved and seconded. All those in favor say aye.
I had a question.
Aye.
I was just curious, for a discussion point, I was going to ask on what the board thought of this. We had delayed the personnel requisition for the IT director last week because you weren't here, and I don't know if you had an issue or concern.
I have no issue or concern. No, I had looked it over. I've been in discussions with Amanda.
And we were going to.
All we're doing today, Linda, is just starting the process. They'll still have that same discussion that you want. So nothing's gonna be lacking. All we're doing is giving authorization for her to start the process.
Yes, well, that's what I mean. We don't have that on today's agenda, so I was wondering if we could add that item
Oh,
back
It is
in.
on today, isn't it?
No,
She didn't put it on from last week?
no, so that's why I was just seeing, since it's an item that really wouldn't require a lot of public input, it'd just be something for our benefit to post it, if that's something we could make that amendment.
I meant for it to have it on today. I'll call her today and tell her to put it on for next Tuesday for vote, for approval.
That'd be the better.
all
I
right.
think it's better to put it on next week.
It's unfortunate. We missed a couple weeks by it because we're up against the clock, but thank you.
Okay, so we have a motion and a second. All those in favor say aye.
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 All those opposed say no. Public comments. Do we have anybody in the boardroom that would like to provide public comment? Nobody is approaching the podium. Do we have anyone on Zoom or on the phone who would like to provide public comment? All right, item number 3, claims and payments. Mr. Perry.
This week's expenditures total $1,815,019.38. The large portion of that is our first half county social services payment of $1,387,080. The sheriff's office $152,570. IT department $63,375. Maintenance department $28,718, and finally secondary roads $118,798. Everything looked normal.
I'll make a motion that the Board of Supervisors approve expenditures and that the county auditor be authorized and directed to issue checks against the various settlement of such claims as allowed. Any comments or questions for Mr. Perry? Mr. Jamison, roll call vote, please.
Little?
Yes.
Schwartz?
Yes.
White?
Yes.
Leyland?
Yes.
Trelka?
Yes. Project updates from department heads. Kathy, good morning.
Good morning, Board. Kathy Nicholas, County Engineer. A brief update on our bridge crew activities. They are working on Hammond Road, and this would be just south of Quarry. And today, tomorrow, probably Thursday, weather permitting, they will be setting the deck beams. So I know some of you have seen that in the past. If you'd like to see that, it is pretty interesting. Just give us a call. We can get you out there. And then lastly, we've also started our annual ditch cleanouts, and we have rented one excavator to help us do that, to get that work done. We have an average amount of ditch cleanouts to do this year, about 3 or 4 miles of cleanout. And we typically wait until the fields have been harvested before we start our work doing this type of job. So can I answer any questions at this time?
Do all the other counties clean the ditches for the farmers?
Yes. Well, it's primarily, so that our drainage is improved in our ditches throughout the county. Some counties do this throughout the year. Many of them are in our situation where we wait until harvest the crops are out of the field so we can just put the material into the adjacent field.
Okay.
Thank you.
Any other questions for Kathy? Any other department heads in the boardroom that would like to provide an update? Do we have any on Zoom or on the telephone that would like to provide an update? All right, I'll make a motion to approve the minutes from October 5th, 2021.
Second.
We have a motion and a second. All those in favor say aye.
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 Aye. All those opposed say no. Consent agenda.
So moved.
Second?
Mr. Jamison, roll call vote, please.
Schwartz,
Yes.
White,
Yes.
Leyland,
Yes.
Little,
Yes.
Trelka,
Yes. Item 7A is a motion for approval of an application submitted by County Social Services for an individual to be admitted to Woodward Resource Center and for the chair to sign the same.
So moved.
Second?
Sure. We have a motion and a second, and I've been provided with the application for admission. All those in favor say aye.
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 All right.
Aye. All those opposed say no. That's efficient, isn't it?
Yeah, we'll do it right now. Thank you.
Item 7B is a motion that the request for purchase of capital equipment submitted by Kim Veeder, Information Technology Director, be approved and direct the chair to sign for same. To purchase 9 laptops and 14 docking stations for $12,695.10 from Sterling Computers to use by staff in various offices within the courthouse.
So moved.
Second?
Kim?
Yeah, so these are laptops for management staff and conservation, treasurer's office, and the auditor's office. The reason why there are the extra 5 docking stations is with the CARES money, we bought laptops, but there wasn't enough funding to get the docking stations to go along with, so that will fill those out as well.
Any comments or questions for Kim? All those in favor say aye.
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 Aye. All those opposed say no. Item 7C is a motion to approve the personnel requisitions submitted for an engineering technician aid 2, Asset GIS, effective October 12, 2021, as recommended by Catherine Nicholas, County Engineer.
Second?
It's been moved and seconded. Kathy?
Yes, we first asked for this position about 2 years ago, and we did hire an individual. He resigned in July after about 2 years. And just due to how busy we've been during the construction season, we wanted to take a few months until we got less busy, until we went about hiring somebody. In that time, we've thought about the position, and this position is very much needed. They've done tremendous things for our department, developed all types of maps, put a lot of information on the website. We did find that once our maps had been developed and many of our databases had been mapped and placed on the website, there's obviously continual maintenance that needs to be done to keep this information current and up to date. And we do have other projects we'd like to get working on. But we did feel that this person did have a little bit of downtime, and we wanted to work with the Conservation Department to work with them and possibly get some of their needs taken care of. They have a lot of needs, as we know, and we wanted to work with them that this individual could utilize working for a few hours or some amount of time for both departments. And I wanted Mike to give his 2 cents worth.
Good morning.
Morning, Mike.
Mike Hendrickson, Director, County Conservation. When Kathy started to chat about this with us, for years, we have tried to develop some type of an ability to utilize GIS. We have 2 employees with a little bit of background in it. We actually sent them to some pretty expensive training, and it got us just about to the point where we could be dangerous with the equipment that we had. And that's kind of where we are. We sort of went in a circle. Before Vern Fish left, he had actually hired an intern with some background to try to get this whole GIS system started for conservation. And it worked, but it's like anything in IT. It's light speed type movements, And what we were able to develop there has just gone by the wayside, and it's bypassed our ability to do what we actually really need to do. I have a list as long as my arm here of applications that GIS could do for conservation and really put us on the map. The three really big ones, the things we really need to look at, we have thousands of acres out there that we manage. Our boundaries need to be identified. They need to be identified to the ability where we can get a whole lot closer. Now, you'll ask, why aren't those boundaries there? Understand, thousands of acres of our managed areas are in river bottom floodplains. And when those floods blow through, like the 08 flood and the 16 flood, trying to find remnants of corner posts and remnants of fences that were there when we probably acquired those lands, they're just gone. And so there's so much work that we can do that way. Our ability to utilize GIS for our grant writing. You know, we chase dollars everywhere. I stand up here and tell you guys all the dollars that we chase. And this would just give us the ability to really frame those grants up and be on a more competitive level. So I could go on and on and on, but when Kathy talked about this, I thought, you know, wow, could we ever really fill some gaps if we had that opportunity? Now, I don't know how that would look, but we certainly have the need. I certainly don't have the ability to step up here at budget time and say I'd like to have an FTE for a GIS person. I can't do that. But I certainly think there's a tremendous advantage when a couple of departments can come together and say, hey, I can probably help you out with this with this one position. And again, I don't know how that's going to look. Conservation would certainly pay their share. However, we could make that work, and that's something that maybe if we can, you know, move forward with this, we can talk with Kathy and the auditor and figure out how that might work for conservation. But we certainly have just a really big need for this, and our staff is very excited about this. They sat down with me yesterday, and we developed all this list and this information. So again, not only has it been incredibly helpful for secondary roads, we recognize the fact that actually what we do is very similar, and our needs are very similar. So it could just be a huge advantage for us too. So anyway, any questions at all?
Well, I certainly appreciate the initiative of two departments getting together to utilize a position.
Okay.
Okay, if you wouldn't mind sometimes forwarding an email of that list, I guess I'd just be
Sure.
curious of what those kind of items are. Some
Yep,
of them.
I sure
We're
will.
not even
Yep.
thinking about
I'll put that together and send it to all of you guys.
Thank you.
Yep. Thank you.
Kathy?
Yes, so with your permission, I'd like to move forward. We would both sit down and collectively and hire the individual. The person would sit in our office where they've always sat. We'd like to go for the next year and just figure out how we can work together. This person, when they did have some downtime, they would go over to conservation and help them. They'd be physically located, working on their computers, working on their systems to get their GIS system where it needs to be. So we'd like to move forward, and we would figure out the cost-sharing arrangement over the next year. And possibly next budget cycle, Mike could come forward to you and actually budget that. I won't speak for Mike on that.
Sure.
It would, what we would be looking at is in the time between now and we submit our budget to you, and we try to figure out how this might all work. I would have that in our budget, and then it would be up to you guys to see whether you would approve it or not, obviously. But we would have that information ready at budget time, so for FY23. So.
All right, thanks, Mike.
Thank you.
Any other questions for Kathy or Mike or Amanda? All right, we have a motion and a second. All those in favor say aye.
Aye.
Aye. All those opposed say no. Item 7D is a resolution that the suspension requested by Diane Olinger on taxes owed for 2021-2022 installments in the amount of $1,552 for parcel number 8913-28-204-005 be approved pursuant to subsection 427.8 of the Code of Iowa, and the county treasurer be authorized and directed to adjust her records accordingly.
So moved.
Second.
Rita?
Typical.
Rita Schmidt, treasurer. Diana receives property tax credit to the maximum that is allowed by the code, and she's fully aware that upon death or sale of the property, she'll have taxes due. So she qualifies for the 427.8.
Any comments, questions? Mr. Jamison, roll call vote, please.
White,
Yes.
Leyland,
Yes.
Little,
Yes.
Schwartz,
Yes.
Trelka.
Yes. Item 7E is a resolution that the letter of support for increasing the number of beds at Pillar of Cedar Valley be approved and direct the chair to sign for same.
So moved.
Second?
Yes, ma'am. Good morning.
Good morning. My name is Kelly Rakuzik, and I am the Director of Marketing and Admissions at Pillar of Cedar Valley. Pillar of Cedar Valley provides a critical service to individuals in our community who suffer from intellectual disability. Our ICFID facility consistently operates at full capacity and routinely must turn away prospective residents due to lack of capacity. By utilizing existing space on our campus, our proposed expansion project will help to fill this need in a very cost-effective manner. As you likely recall, Black Hawk County operated the Pillar facility for over 30 years. At that time, it was known as the Country View facility. In 2018, the Country View facility was one of only 2 remaining county-owned facilities in the state. In early 2018, the county projected that operations of the largely Medicaid-funded facility would incur significant budget deficits in 2018 and 2019. As an alternative to closing the facility, which would have left residents with no local options for care, this board explored options to sell the facility. The board ultimately decided to sell the facility to our owners, who assumed control of the facility on January 1st, 2019, and changed the name to Pillar of Cedar Valley. One of the factors Pillar evaluated was how to use existing space more effectively. Pillar engaged in a comprehensive analysis of the needs of residents and the needs of the community at large by looking at the existing space and by talking to family members and area discharge planners. This analysis culminated in changes that take underutilized spaces and return them to use as resident rooms so that they can provide care for people in our community who need it. In July of 2019, Pillar requested State Health Facilities Council approval to expand the capacity of the facility's ICF PMI and ICFID. Following the council's approval of those projects, Pillar promptly completed the necessary facility upgrades and placed those additional beds into service about 3 months later. In the 2 years since the Pillar expansion, the need for ICFID beds has remained consistently high. Even with the additional 11 beds added in 2019, we have continued to operate at capacity with a lengthy waiting list. That is why we are again seeking approval to expand our ICFID facility. This time we are planning to add 8 beds in existing space to our ICFID. This project would bring the total capacity of our ICFID to 53 beds. Unlike our ICF-PMI and NF units where the residents are age 65 and older, in our ICFID unit, many of our residents are admitted as teenagers or young adults who have not been successful in community settings. Many of our residents exhibit violent tendencies, which requires a high level of staff involvement and training. Our ICFID beds consistently operate at full capacity, and we frequently must turn away prospective residents due to the lack of capacity. This project will help to fill this critical need in our community. I would like to share a little bit about the residents of our ICFID facility. Although many of our residents have co-occurring mental health diagnosis in order to be considered for admission to the ID unit, an individual must have an intellectual disability as a primary diagnosis. Intellectual disabilities can include autism, Down syndrome, but many individuals also have other diagnoses, including mental health. Individuals must have an IQ below 72 to qualify for the ID level of services. The individuals residing in our ID unit have widely varying lengths of stay. Several of our residents have been at the facility for more than 30 years. Younger individuals sometimes only stay 1 to 2 years and transition back into the community. The average age in our ID unit is 45. We focus on individuals aged 16 and older, but the youngest person we have served was only 9 years old. All of our ID residents are on a Medicaid MCO. In order to further improve our residents' experiences at Black Hawk Nursing, we will also be making some improvements to the common area and the lower level of the facility. And I believe Linda gave you pictures of all of that. Just would like to thank you for your time, and I would like to ask for your support in this project.
Any comments or questions for Kelly?
I'd say I've supported these recommendation letters in the past because I know we need more ICFID beds in the community. But today I'm going to have to vote no just because I've had too many troubling reports from the Department of Health and Human Services Centers for Medicare and Medicaid Services about some really kind of troubling conditions that have been there over the last year. And so I'm going to have to vote no today.
Any other comments or questions?
No, I said I was going to comment. I hadn't actually got to read them thoroughly from the information you provided, but I said it was nice to see the support from the county social services and, like I said, many others as far as those familiar to us, Elevate and Bob Lincoln and Mercy One, University of Iowa Healthcare. So I'm very pleased, like I said, that we were able to keep the facility in this community and serve the people of our county and other surrounding counties. The needs are great, as we all see, and continue to be great. And so I'm sorry to hear that, Chris, but I would hate to see, like I said, us not be able to expand, help with the expansion of this project, or if there were others that were willing to do this. So thank you.
Yeah, I mean, it's certainly needed.
Yeah, most definitely.
How about employees? Are you having a hard time getting employees? I mean, is that a question you're able to answer in your capacity?
Staffing is not low. I mean, we're not using that much agency, especially in our ICFID unit. We don't use any agency in that unit, but our staff is lower than what it has been, and that's been a struggle, but we get by.
I was just curious about that because
Yep.
that's a struggle across so many industries right now.
There's tough.
Looking at the people that sent letters of support, knowing several of them, and knowing the work they specialize in, I'm happy to say I will support this.
All right, any other comments or questions?
And like it's been said, there's much needed service that this is never going to go away. I'd love to see it go away, but there's always going to be people that need brain health help at different times in our lives. So I'm glad to see that we are able to expand our services.
Okay, we have a motion and a second. Mr. Jamison, roll call vote, please.
Leyland,
Yes.
Little,
Yes.
Schwartz,
No.
White,
Yes.
Trelka.
Yes. Item 7F is discussion and possible board action in regard to the Security Committee meeting recap with the Board of Supervisors regarding Pinecrest security. Rory?
Good morning, Board. Rory Giving, Maintenance Superintendent. Several weeks back, at the request of the Board of Supervisors, to gather the Security Committee meeting to discuss services for the to discuss the existing services, guard services at the Pinecrest facility, and whether or not the committee felt that the services should continue. So we did, as a committee, we did meet, and we reviewed staff feedback, old and recent, concerning the guard services provided at the Pinecrest location. Several items that were addressed previously with the board, for an example, personal items at the workstation, that has been addressed. Involvement with the public with regards to providing instructions that they may not be fully capable of handling that type of information with the public, that has been addressed by providing the guard a script to use. Monitoring the parking lots, we have been working with the guard over there to increase that process, and more rounds throughout the building. And we are seeing an increase in the rounds. In fact, we get a report, a weekly report of those rounds that are being completed at that site. So I shared that with the committee, and as we kind of went through that process. We looked at, again, staff feedback. We looked at additional training that can be done, not only with the guard, but with the staff over there at the Pinecrest facility as well. We suggested that both the staff and the guard become more vocal in relaying any complaints or information to us here so we could more efficiently and quickly address them, which I do feel that has taken place too. In fact, I shared with the board an incident report that we had received on Friday. If you noticed on that report, I was pretty impressed with the amount of detail that was in there. So that's what we like to see. I'm hopeful that we can continue to see that from this guard. So with that being said, the committee as a whole has decided that because of the types of services that the Pinecrest facility provides and the original intent of this guard, the committee would like to see the board continue with guard service, at least throughout this contract. And just so you know, the existing contract that we have ends on December 31st, 2022.
Rory, you don't remember? You brought this to the board already, and I made the motion, and I didn't get a second, so this issue died about a month and a half ago.
Yeah, I think it was after that it was asked to go back to the committee.
No, we got all the information that you just said, and I made the motion to eliminate that person, and it didn't get a second, so it died for lack of support, and the issue's over. So
Well,
many times are you bring this back to the board?
Well, it did die that day, Tom, for lack of support, but I did make a statement and asked the committee if they didn't mind meeting again, because I said we needed to kind of put the thing to rest if there was any need for reconsideration of it. So
to rest now, I mean.
Well, we can vote on it today and put it to rest, I guess.
Yeah.
For the period of this contract, or until we have another issue.
Right.
But the other thing, Rory, when you mentioned you're working with them to go out in the parking lot, that should have been on automatic. Doing that parking lot, I don't think there's much action out there in that front lot, even though we've had some problems lately, but you would have thought that would have been part of the responsibility that you'd have to tell them.
Yeah, and that was actually part of the reason why this became a topic of discussion is because the lack of the services that we felt that we should have been getting, and as we mentioned earlier on, a lot of it was due to the timing of the COVID and having that guard in the lobby and making sure that individuals had their mask on. And so our original intent was really skewed at the beginning of why we wanted this guard there. So now we're at the point where we're getting back to that original intent.
Yeah, I mean, it was COVID originally. That's how that job got created. I think the security committee that you guys have organized, put together, they do an excellent job for Blackhawk County. But the issue that they don't have to worry about to deal with when they make these recommendations is how to pay for it. The Board of Supervisors has got to figure that out. Like I said the last time, for what that person does out there, and this isn't against the person, it's against the position, I think it's a waste of tax dollars out there. We went 40, 50, 60 years without anybody out there. They got that front desk open now on the main floor, and what'd you say, this is $700 to $800 a week to have somebody there?
Roughly $700 a week, yes.
The cost?
Yes.
To me, that's ridiculous. That's waste of taxpayers' money. But anyway, I think we should have a vote today, be done with it, and move on.
Okay, good. I think that's a good idea. So
all right.
I'll make a motion to approve the continuation of security services at Pinecrest until December 31, 2022.
Ray, I got a quick question for you.
Yes.
Going out there quite a bit, there isn't that much, like Tom said, there isn't that much traffic or people coming in and out of there that stay very long. So I don't even, I think it's, a waste of time to do the lot myself. Here's where we need the lot, check periodically, because like I've said before, there's people, the second they know that the lot's been checked for that period of time, they go get their cars from wherever and pull in the lot. And we're having a lot of trouble with enough room here. So I don't think I've ever seen a problem out there.
Yeah, the only, I guess, go back to the lot. The only thing that we're doing with the lot is we're enforcing how the ordinance is written. In our ordinance, it does talk about a specific location for the employees, and it talks about a specific location for the public coming in. And honestly, there's not a lot of issues that we see with the lot. If you recall in our minutes, there was an item in there that we had talked about where it appears that parents are parking over there at the end of the day, waiting for students to get out of Expo. So that's one potential issue that we're working on trying to address. But it's more importantly, we're just trying to enforce the ordinance. So the people that are following the ordinance, are doing it correctly, but then you have that just a small handful of people that are going against the ordinance. So we're just trying to adhere to that.
You're talking about employees, right?
Yes, it's primarily employees.
Yeah, and the problem with the people that are pulling in there for over at the school, somebody needs to walk across the street and talk to somebody over at the school and let them know we don't want them parking there.
Yeah, and we've had this issue where we did get this. We had buses turning around in our lot. We were able to sit down with the school and get that addressed. Now, this is a new issue that just needs to be addressed.
This came before the Board of Supervisors about 15 years ago, I believe. Mm-hmm. And the problem was, once the board was made aware that we had parents parking in that lot and the kids were walking across the street, we had to do something about it because there's a liability there. If somebody would have got hit on that street, because we're allowing the parking in our lot. So I would suggest that if this is still going on, I heard it about 3 weeks ago, a month ago, that they were being parked there. If this is going on, we should put a stop to it.
Yep, and that was instructed to the existing guard that's over there now to keep a close eye on that.
Well, it's out there now.
Yep.
Okay, we have a motion. Do we get a second yet? I will second it.
Thank you.
Thanks, Rory.
All those in favor say aye.
Aye.
Aye. All those opposed say no.
Hey.
Item 7G is discussion, county preparedness and possible updates for COVID-19. Dr. Nbunya, I saw you. Is she still there?
Yes.
Oh, yes. Okay, yes, ma'am.
Good morning, Board. This is Dave Boyne, Blackhawk County Public Health Director. Just a brief update again. Our risk level remains high. And the reason for that is also of our positivity rate, and that's also communicated. We're using the CDC guidelines for those calculations. Vaccination status as of 10/11, we have 66% of Blackhawk County residents ages 12 and over that have at least one dose of COVID-19 vaccine. And also 66.6% of Blackhawk County 12 and over that have at least one dose of the vaccine in comparison to the state average, which is 65%. Upcoming FDA meetings, I'm pretty sure most of you all have been listening to the news and hearing this. Moderna and Johnson boosters and the mixed series are going to be discussed on 10/14 and 10/15, and also the discussion in regards to Pfizer for the 5 to 11-year-olds on October 26th. And then Merck submitted also their COVID-19 antiviral for FDA approval, so we're waiting to hear about that. You will see in the lobby of the health department we have COVID-19 test kits. We're getting weekly at-home test kits from the state. and we're distributing it with our local healthcare systems as well. Unity Point, People's Community Clinic, and Mercy One. We've also ensured that they've and have it in also the rural, smaller town locations. But also here at the department, in the lobby, there are COVID-19 test kits, and we'll make sure to supply as much as we can. They're at-home test kits and very easy to use, and so available for people. And then Monday through Friday, people can drop off their sample at People's Community Clinic or at a UPS postal office. So that is the update that I have for you all in regards to COVID-19.
Any comments or questions in regard to COVID-19?
Dr. Ibanye, what chances are there of being user-friendly and taking shots into the schools so the parents don't have to be running around getting them shots? Is that possible? If they have
the vaccination?
Yes.
Yeah, that's pretty hard because the hospital systems are stretched really thin. You know, there's really high demand and personnel is low, and so we've talked to our hospital systems, and really that's very hard. I think that if there's any concerns in regards to getting vaccination, Supervisor White, my recommendation is they can call the health department, and we will help them navigate that. But definitely, we're waiting to see what the Pfizer is going to look like for the 5 to 11-year-olds, and I'm pretty sure the pediatricians are going to want to be able to have those discussions with the parents as well. So, but those are discussions that we're having in our weekly COVID-19 meetings.
Thank you.
Any others? Okay, item number 8. Any information or any reports or information from the board?
Motion to adjourn.
Second. All those in favor of adjournment say aye.
Aye.
Aye. All those opposed to adjournment say no. We are adjourned.